I am Dr. Pradeep Bardhan. I am from the ICTDRB in Bangladesh. I'm a clinician and also clinical researcher. And I'm looking at having experience in treating cholera outbreaks in many different continents, including Africa and Asia. And I'm going to Haiti as being asked by the WHO to provide use my experience to provide whatever help I can be to Haiti. The first thing to realize by all the healthcare providers in each and every level is not to panic. This is a disease which is very much treatable and not difficult to treat. The important thing for all healthcare providers, doctors, nurses, pharmacists, healthcare volunteers, is that whenever there is a suspicion of cholera, not to delay. The treatment is simple, but one has to take actions promptly. That is the important thing. You have to take actions promptly, not difficult problems, and the guidelines say it very clearly. The main problem in cholera, like in other diarrheal diseases, is dehydration. Cholera is just like any other diarrhea, just it's a little bit more severe, and that's why we have to take actions quickly. When patients are coming with diarrheal disease and reporting to in the reception for the triage, it's important to immediately recognize which patients are severely dehydrated. It's very important because severe dehydration is a medical emergency. These patients cannot wait. They have to be immediately treated. So the important thing in the triage is to recognize what are the signs of dehydration, if they are there, and if there are signs of dehydration, what category of dehydration it is, what is the degree of dehydration. If it is severe dehydration, immediate actions. In many of the times, you will see that patients who are coming in the triage with severe dehydration, they will have feeble pulse, or sometimes you cannot even feel the radial pulse. Immediately, you put on a needle on the veins. If necessary, in adult patients particularly, you can put on several lines at a time and keep on giving fluids till you can see that the pulse is returned and you can count the pulse. Once the pulse is countable, then you know that okay, you are doing it rightly. Then you can start getting down, making the calculation how much fluid this patient will need and make a ration. But till the pulse is countable, it's an emergency you are tackling, so you go on giving fluid as quickly as possible. In our hospital, we have patients where we have put on 4 lines, on 4 limbs, on 2 arms and two legs at a time. The target should be that within 3 hours, all the patients should be fully rehydrated. Now, one thing we need to keep in mind is that when the patient has come to the healthcare center or the hospital, depending upon the degree of dehydration and assessing the patient's body weight, we make a calculation. Okay, this is the initial deficit they have. So, for example, a adult patient weighing roughly around 50 kg has come. So the initial deficit is approximately 10%, which is 5 liters. 500 mLs of fluid, that is the 5,000 mLs of fluid, that is the initial deficit. But which we should be giving over the period of 3 years. But please remember, and we need to remember ourselves, that within these 3 hours, the patient might be losing even more fluids. So we need to put on that add-on on the calculation of total fluid. Use of antibiotics in cholera reduces the duration of the disease and also reduces the severity of the disease. So that's the reason why we say that yes, antibiotics should be used in cholera. Which antibiotic, as I said, depends upon the local sensitivity pattern. As much as I know about the sensitivity of Vibrio cholera strains, which have been isolated from Haiti, we know that they are sensitive to tetracyclines groups, they are sensitive to ciprofloxacin, and more probably they might also be sensitive to azithromycins. So at least in Haiti, in adults, a single dose of doxycycline 300 milligram should be okay. However, as you know, that we do not profess giving doxycycline to pregnant ladies or to young children. In those situations, the other option would be using azithromycin. In an adult, the dose would be 1 gram, single dose. In children, it is 20 milligram per kg, also can be used as single dose. Simple. However, we have to remember that the main treatment against cholera is fluids. If we give fluids to a cholera patient, not antibiotics, the patient may need extra day or 2 to recover, but will recover. But if we have a cholera patient, we give antibiotics but no fluid, it's not good. We might very well lose the patient. We have to remember that these patients are likely to go on passing fecal matters when they're in the hospital, when they're being examined. So the clothes, the bed sheets, they will be dirty and getting dirty. The people who are attending them might also be getting some of those things. So we need to also, and the cholera excreta is infectious. So whenever we are looking at treating and managing cholera patients, there has to be systems where we can properly dispose of those infected and contaminated materials in a proper way, not only for the patient, it's also for the healthcare providers themselves. For example, in our hospital in Dhaka, that's the capital of Bangladesh, we treat more than 100,000 diarrhea patients every year, and a lot of them are cholera patients. And we have been doing that for the last 40 years. And over this period, there has been not a single instance of any of our staff in the hospital contracting cholera from any other patient. Not a single instance. The reason being that the cholera requires quite a high dose for infecting dose, what we say, to make a person sick. And so you just cannot get cholera by touching a cholera patient or hugging a cholera patient like that. But by using universal precautions and the things that we have talked about earlier, our hospital staff will be pretty safe. They will not be having any cholera by themselves. No reason to panic. Cholera is a simple disease to treat, and the important thing for us will be to recognize that yes, this is a patient who comes with diarrhea, with dehydration, could be a case of cholera. Treat the patient like that, keeping in mind, remembering that the most important thing to do is to keep the patient hydrated. As long as we can keep the patient hydrated, and there are very simple clinical parameters to know how to keep a patient hydrated, to recognize the signs of dehydration. If we keep the patient hydrated, even if we do not do anything else, the patient will recover.